So what are some side effects I have to worry about?
So generally speaking, hormone replacement therapy is very well tolerated. Sometimes there can be some mild side effects of acne, and some guys can experience a little bit of increased hair loss. Sometimes your blood pressure can go up a little bit, and sometimes your red blood cells can go up a little bit. But I have ways to mitigate all of those problems, and usually is not an issue.
So generally it's a safe protocol?
It's a very safe protocol.
And once I'm on, how long before I notice something?
Generally speaking, within about 2 weeks to 4 weeks, you'll start to notice that you get an energy pop, your mood will improve, your libido will improve, and then over about a month or two, you'll start to notice that your workouts start to get better, your motivation increases. Long term, after about 6 months to a year, you'll really start to see the body composition changes that need to occur. And that's really what drives my protocols, is body composition. I'm looking to see that you are changing your lean muscle and fat composition. And that's what I usually base my goals on.
Okay. And how often do I have to get labs?
So generally speaking, I get baseline labs before we start. And then usually about 4 months after we start, I get labs to reevaluate where your levels are and your red blood cells. And then from there, it's anywhere from 6 months to a year afterwards, once your levels have stabilized.
If I have some labs already, will you review those?
Yeah, I can review those easily. You import them into the system and I can review them.
Got it. Is testosterone replacement therapy only for men?
No, testosterone replacement therapy and hormone therapy in general is for both men and women. Typically above the age of 35 is a good time to start if you have signs and symptoms of low testosterone.
And how can women benefit from testosterone replacement therapy?
They benefit from all the same reasons that guys benefit from it. If they have low energy, low libido, worsening body composition, they get all the same results as guys get, but just delivered in much smaller dosages.
Is there any benefit to women going through menopause using testosterone?
There's a lot of benefit to it. It actually mitigates a lot of the symptoms and signs of menopause. It also helps with osteoporosis in women, preventing that. So yeah, it's a great thing for women that are in a perimenopausal or menopausal stage.
Okay.
It's perfectly safe too. There's no increased risk of cancers.
And where do the medications come from for Aspire?
We get all of our medicines delivered from a 503A FDA regulated compounding pharmacy. So these are all third-party tested medicines delivered straight to your home